Hi, Mark Rogers here. I've been an insurance agent for almost 20 years, and I will say that working with retirees during this time of year with Medicare can be a real stress for many retirees. You know, I've seen a lot over the time. I've seen TV ads that are just coming in like there's nobody's business. TV ads that are just blasting things out, and frankly, some of it doesn't apply. And so what is a retiree supposed to know? There may be the stacks and stacks of mail that come in is a real thing. The mailbox is getting full of Medicare ads that, again, is it the right one? I don't know. We don't know. So we move on and we find out the phone sometimes is ringing too. And it's a real thing to have the phone ring. And who do you trust on the other line? So it's important things to say, well, this go around, I'm going to go ahead and stream out a live broadcast on Facebook and YouTube. And we're going to be sharing unique ideas and tips and strategies and processes as we come up. So make sure and tell your friends to join the Facebook and YouTube stream, Medicare with Mark, Tuesdays, Wednesdays, Thursdays, 9 in the morning for the entire month of October. 3 days a week, we are streaming live. Look forward to seeing you there. Ask your questions, bring your questions, share it with a friend. Make sure your friends know about it as well. We'll see you online. Hello, everybody. Good evening, everybody. Ha ha. Here we go in the evening time. Medicare. It's Medicare season right around the corner. And I'm hoping you guys are doing well. I had someone say, Mark, can you run a little broadcast in the evening? I'm like, yeah, let's do it. Let's have fun with this. So we this morning we did a little broadcast at 9 o'clock in the morning, and it turned out to be I had some technical issues. So we're square. We're square this one. So hoping, you know, I don't have coffee. I don't do coffee. Well, I do coffee in the evening, but right now I'm not doing the coffee. So anyway, let's just jump into it, shall we? And if you got questions along the way, we're going to go ahead and you can throw those in the chat, and I'll try to get to those as we go along. If you don't do that, I also threw a little agenda together here. We kind of run with some of the similar agenda out of the gate. However, I like to kind of mix it up a little bit. There are so many topics around Medicare and healthcare planning to share. It can't be done in 20 minutes. It can't be done in 30 minutes. And so we just try to chew along the way here. I do see there's really a core feeling about what we could be having for healthcare planning. So I do have that going on. So let's talk about a very common piece of research is being done, basically just saying, I just snagged this from Fidelity, Retiree Health Costimate every year, is they are doing this research to show, you know, $315,000 is the average couple turning 65 for healthcare expenses. And so that is, that is a considerable amount of money that a couple has to plan for. And so I just want to make sure that, if that is something that concerns you at all, there is a way to circumvent that, and it's really requiring to really study healthcare expenses in a way. You know, is it about stocks and bonds going up and down? Is it about this, buying gold, not buying gold? No, it's all about, can you stop the healthcare expenses from draining out over the course of time for retirees? And so that's kind of a big deal there. So let's jump over into, let me just kind of grab this here. I got a piece of news. We shared a piece of news this morning, and I wanted to go into a piece of news that I've got coming up here right now. So let's just pull this piece of news up here. I thought this was very interesting, and I'm bringing this piece of news to our attention for a particular reason. And that is, this morning I pulled a piece of article out of, where was that? It was one of the Market Watch. That's where it was, Market Watch, with regards to the mistakes that people are making around Medicare Advantage plans. And so I thought, well, let's talk about Medigap plans for just a second here. And so with that, let me go ahead and share the news article that I've gotten up on deck here. This actually came out today on CBS News. Is Medicare supplement insurance worth it? Here's what some experts think. And I think this is very interesting. For those of you that don't know me, I've been doing Medicare stuff for about 15 years now. I've seen it all come through, and I got my opinions, but I realize too that my opinions don't count because of the fact that everybody is different. Everybody is different. So with that, let's talk about some of the things that they're talking about here. Medicare Supplement insurance, also known as Medigap, is extra insurance coverage you purchase from a private insurance company to fill in the gaps that original Medicare does not cover. All right. And so that is something that these plans have been around, 40, 50 years? I think early 70s is when these things started coming out. So, that's a Medigap plan. When is it worth it? Well, it's to pay for those gaps that we talked about there. And it says when you enroll in Medicare, this Amanda Reese, a Medicare department manager at Hayfetch and Associates, recommends enrolling in Medicare supplement insurance when you first get Medicare A and B. Okay, that's when you're going to be turning 65, or if you're coming off of an employer plan. And we talked about this too as well, is if you're coming off an employer plan, you have the ability to get one of these as well, even on a guarantee issue. She continues, this allows you to get into the plan is available to you without any underwriting, all right, without any underwriting or pre-existing conditions. And so that's kind of a big thing as well. And if you have the opportunity, consider getting Medigap before 65. Another time you strongly look at Medicare supplement plan if you get Medicare under the age of 65. All right, so let's keep on going here. When you want to use your own doctor, that is a critical thing. And if you're listening in, listen up. There are Medicare Advantage plans that are leaving counties. There are Medicare Advantage plans that are changing networks. And there are hospitals that are not taking Medicare Advantage plans. Be very aware of this. So a Medigap plan would allow you to go anywhere you want to go, anyone that is billing Medicare directly. So this is when you get to use your own doctor. You may also want to consider supplement when you want your doctor and not the insurance company in charge of your care. That's very nice. You want to be in care, and you don't want an insurance company in care. So that's good. When you want to protect your finances against costly healthcare expenses, right? And so if your budget has little room for emergencies and the what-if situations, Medicare supplement insurance coverage could help you overcome unexpected expenses. All right. And of course, Medigap plans are not for everybody. You may decide to forego Medicare supplemental insurance in certain situations. So, when you have coverage, already have coverage, no, you wouldn't do a Medigap plan. Or when the premiums are too high, yes, it becomes unaffordable. That's not right to have either. So those are things that you would do that. The bottom line, let's read the bottom line here. Ultimately, deciding whether Medicare supplement insurance is worth it comes down to the benefits and it costs as it relates to your personal situation. Seniors should view supplements as a guard for their budget, an open door for medical needs. It should be viewed as a product and brings predictability and peace of mind. Okay. So that is really what it has done in the course of me working with folks. Is it really has taken a peace of mind associated with it. When someone puts a Medicare supplement plan, it puts them in control. I so like that, what that is. So with that, let's go ahead and jump into, I'm going to do a little whiteboard explanation here of this. So I'm going to continue on with this. And let's make sure the technology works, huh? That's always good to see if the technology is working. All right. So, when you have, is that even on the thing here? Let's bring that up. There we go. So when you have part A and part B, we had some comments on the chat today, and I wanted to review that. And that is, there's some chats that going, don't look at, is it Medicare disadvantage? They were dissing the advantage plans. Fair enough. I've done this long enough. I have my opinions about it. And yes, I am a big proponent of Medicare supplement plans, but there are some miscommunications and not everybody is the same. All right. So moving forward here, let's just, let's look at this a little closer here. You can go into a, let me just turn on the pen again. So you can go into a Medigap plan, okay, Medigap or Medicare Supplement. They're also known as supplement coverage. So these are going to basically pick up all the gaps along the way. Now, one thing supplement. Don't take me for, there's a Medicare Supplement. Over here is a Med Advantage, MAPD as they're known, all right, MAPD. Now, the key thing is, looks like I lost my camera source. Let's take it back up here. Should have it. There we go. The Medigap plans are going to basically bring in, they're going to bring in the inpatient stuff. You're going to bring in inpatient. They're going to bring in outpatient stuff. Okay. They're going to bring in dental stuff. Okay. Sorry for the scribbles. They're going to take in some vision stuff. There'll be some gym membership stuff. There may even be some give back stuff. All right. So it's going to basically, it's just going to combine a bunch of things. All right. And so that's the thing to think about is when it's doing that, it's really taking it and it's doing a bundle job on things. Okay. The question is a bundle job what you want when you're talking about healthcare? All right. So if we're talking about an unbundled, so I'm going to label this unbundled care versus bundled care. All right. So a Medicare Advantage plan sits there and bundles a lot of stuff together. All right. But an unbundled plan would be something along the lines of, you got your hospitals, let's take this line off here. Let's do this line off here. And let's go back to this here. Whoopsie. Sometimes when you learn how to write, you got to learn how to write here. So let's do it in green. So basically, this is your Medigap plan, which would be your hospitalization and your outpatient stuff, right? But then over here, you would have your dental plan, okay? And then over here, you'd have your RX plan, okay? I forget to mention over here, we would have our RX as well. So if something goes wrong here, all right, if something goes wrong and you go, my goodness, this is a problem, my drug plan is a problem, well, then the only thing we're doing is we are going to go ahead and circle in, okay? We're going to circle in and go after just making sure that we're going to go after that, changing that pharmacy plan. Does that make sense? When it's unbundled, we get to go after a one piece and change it. And perhaps it's a situation where, maybe my premiums, okay, maybe my premiums for my Medigap plan, okay, maybe they're getting a little out of control. And they do. Sometimes they're running for 10 years with clients. I've got clients that have had them for 15 years, right? Sometimes this is going on. And you can go, well, let's see here. Can I actually change my Medigap plan out? But I'm still going to keep my dental plan in place and my pharmaceutical in place, or change it. So we change it out a piece at a time. However, when you're over here on the bundled side of things, the bundled side says that when retirees are in their their 70s and 80s and such like that, they're always having to sit here and go, I'm having to change the entire package every single October, November. And so that's what's key about it is do you want to do a bundle? You want to do a bundled piece, or do you want to have it so that, let's call it bundled. You want to do bundled, which is going to be your Medicare Advantage plan, okay, prescription drug plan all together, versus unbundled. Okay, unbundled, and you get to control it. Okay, so you get to control it. So that's just my little two-piece word, because some people are knocking one and knocking the other. I'm not knocking either one here. I'm just saying one is going to be bundled and one is going to be unbundled. And the unbundled version over here, okay, the unbundled version will take a little bit of management, right? A little bit of management, okay? And that's where it's so nice to say, I got my this, I got my that, I got this. If this isn't working, I move that out. And that's how that works. But over here, when you're in this scenario right here with a bundled position, inpatient, outpatient, drug plan, vision plan, gym membership, give back and the whole bit, prescription plan, why it becomes quite a challenge to sit there and have to rotate that out every single year. So that's my little thing about bundled versus unbundled. I hope that's kind of helpful in terms of that, Medigap versus Medicare Advantage with that. If any questions come up, let me know. I'll be watching the chat to see if those would come in along the way. And let's move into the next segment here, which I love this segment. I just came up with this one here. Let's do the old spin the wheel here, huh? Okay. There's a lot of topics that I put together, and I'm like, we can't choose every one of them, so we're just going to do one a night or two in the morning or something. So we got our spin the wheel here with different topics going around. So let's take a look and see what we would have on that. So let's go ahead and spin the wheel here. This is kind of a fun thing. So we just do the old spinaroo. Well, plays a little music along the way. Where do we land here? I like the move too, huh? All right, savings with Part D. This is good. Savings with Part D. So let's talk about the savings with Part D, because this is key. So as I was just talking about the unbundled feature, let's go back to our whiteboard here. And so you are able to, if you're taking a Medicare supplement or you have straight Medicare, all right, that's going to apply in either way here. Let's take a peek here. And that is, so Part D, all right, we're asking for savings. How do we save? Well, we're saving on Part D because in an unbundled feature, we're going to be looking at our Part D only, our drug card, right? This time of year, folks, this time of year is when you look at it. And what we're doing is we're putting everything down into an engine here. And so we got an engine sitting here. And that engine is, we would put in your pharmaceuticals. We would put in your pharmacy, all right? We'd even put in your doctors if you want to do that. And it comes out. And then down here, we're going to have Plan A option, Plan B option, Plan C option, and we're looking for, this is what I'm looking for. I'm looking for the lowest cost, okay? I've been doing this some years now, and it's interesting to see. The fact is that someone says, oh, no, I have Plan A. This is my plan. I've had it for 2 years, and this plan is now going to be running me next year. It's going to be running with all the prescriptions I take and such like that. Maybe it's going to be running me $700, right? Card and the thing, running $700. But then we look at this card, it's like, oh, well, this one's right here. It's $400. Oh, okay. All right. So this one's $400. Same drugs, maybe have to go to an online pharmacy or whatever it may be. And now we're looking at a $300 delta sitting here, right? A $300 delta. My question is, does $300 savings next year, does that become a big deal? That's what the savings is. It's just running it through the system to find out, can I get $300? Can I get $400 worth of savings? And that's what I'm looking for. That's what my main goal is right now, to help people, is making sure that we get those savings associated with it. Okay. So that's a quick little thought on savings on that, just to make sure I covered that. I also do have down in here, we have the drug stages we've talked about before. There's the deductible, there's initial coverage, coverage gap, catastrophic coverage. Those are the stages that someone goes through in the drug plan. Before I go on with that, when you do the analysis and you plug in your drugs, it will definitely show where you're ending up in these stages here, right? And most people are hardly moving past the first stage, maybe the second stage, okay, the way things are working. And so that is something that, you want to get that report to show what's going on with that, okay? All righty, so that is, and they do have tiers and things like that. And we talk about the different tiers that are going on along the way. All righty, so with that, we got a question. How do I get enrolled in Medicare? Well, that's good. Let me just throw that over here on the how do I get enrolled in Medicare? And so that is an interesting topic. So Medicare will come at you when you turn 65, okay? So turning 65, you will have the Part A coming directly at you, all right? And then Part B is going to be pulled directly from your Social Security if you're taking Social Security, or you pay it out of your checking account. Now, if you're still working, we've kind of been talking about that a little bit. If you're still working, then you probably won't turn on your Part B, your Medicare Part B. And so to get enrolled in Medicare, again, if you're just retired at 65, your Part A turns at 65. It turns the first day of your birthday month. First day of your birthday month is when that will happen. And then after that, your Part B will be that same. If you're retired and your Part B, you're going to start paying a little premium for that. Your premium will be determined by your Part B premium will be determined by how much you've been making along the way. Okay, so I hope that helps on that, because it's always good. It's always a question mark. If you've got your Social Security turned on, your Medicare will probably turn on as well. Of course, talking about Social Security puts a whole nother spin on things, because that's another analysis that has to be done along the way. All righty, so that is good. Thank you for that. And that is about it. I think we should be good to go. Oh, I wanted to share real quickly that we got some other videos that are coming back up here, but if you do want to go on, you can go to medicarewithmark.com/compare. Put your data in there, okay? You're welcome to input your data. That's all we're talking is pharmaceuticals, doctors, and in your pharmacy. And then we'll send you out a scope of appointment. That is a Medicare rule this year. That's even heavier than before. You want to make sure you click that so that you will agree to talk about the Medicare stuff. And we would meet 48 hours later on the phone or on the Zoom or even in office if need be. That is what is going on if you want to get the process going. All right. Now, also what's coming up down the deck here, we're still working on things, is we're getting actual webinars set up with specific carriers. And these are going to be specific carriers that are lining up on webinars. So you're going to stay tuned to the Facebook channel and the YouTube channel as those come out as well. So tell friends, tell neighbors, and it looks like I've got a few more people jumping on. If you have any questions along the way, throw them in the chat. I can see what we can do to roust up a good answer. So always happy to take feedback. And with that, we'll go ahead and catch you tomorrow morning. All right. See you then.